This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by board-certified Dr. Jason Martin.
Very extremely board-certified today.
You know what I was thinking this morning is like, I need to get Jason Martin MD on my scrubs, but then it felt like a little like possessive, you know?
Right.
Like property of, right? So I'm like, no.
Why don't you get your name on there with our logo?
Right, I could do that. Yeah, with the MD. Like Jason Martin MD.
Yeah. We kind of are like Siamese twins a little bit.
We kind of are.
Probably an inappropriate term these days, but
yeah,
kind of bound at the hip.
Yep. So if you're listening to this episode only and you'd like to see the slides and the video that go along with this, because there is a video of us talking right now, you can find that on our YouTube channel at Jason Martin MD. You can find us on Instagram at Beauty and the Surgeon Podcast. We really appreciate you all listening. And if you are so inclined while you're here, give us a like, a comment, a rating, review, and subscribe. That would be awesome. I'm really excited about this episode today, Dr. Martin.
Tell us why you're excited.
Well, I'm mostly excited, as I was explaining to you and Nils before we started recording, that I like talking about geeky stuff. And I feel like lately we've been talking about a lot of plastic surgery things, which is awesome. But I like geeking out on research.
Right. And this is in our private lives, in our Amy and Jason lives, this is all the stuff we talk about.
Specifically about longevity.
Right. Amy and I rarely call each other up and we're like, hey, your approach to facelifts, what do you think about this? Ever. I mean, how many times do we do that? There's maybe twice a year where you call me up, you're like, how are you going to do this? And I'm like, I'll figure it out, pretty much.
Yes.
But almost always we send articles back and forth to each other or like cool products we found, that kind of stuff. To be honest with you, that would probably be an even more engaging podcast. Maybe we should do a second podcast on stuff that Amy and Jason are interested in.
Well, we have our episode stuff we're into, but specifically about longevity, we had an episode 50, where we talked all about longevity. And for this podcast, I actually pulled a clip of it for us to watch. So if you're wanting to go back and listen to that episode, like I said, it was episode 50. It was called Longevity. And we were talking about research around longevity, which today, Dr. Martin and I each picked one emerging. So this is research within the last 12 months. They were both studies that were done in 2020. So this is new research on longevity specifically. And we're just going to talk about one of them. But before that, Dr. Martin, I'm going to play us this video clip.
I didn't know this.
Yes.
Is this a surprise?
This is a surprise.
Nils.
So here we go.
Am I going to have a big bloated face?
I struggle with this because isn't there a big part of aging with losing muscle mass?
Sarcopenia. It's huge.
So why would you want to treat one of the bigger factors that allows us to put muscle on and to age, like you're saying, functionally?
Yes, to have a functional aging.
Yeah.
Yes. And that's where the longevity thing, it's like nutrition. There's no one solution that's the one thing. Like you asked, like, why can't we just fix this? It's because it's not just one thing that's happening. And everything has a consequence in the body. It's like traditional Eastern medicine talks a lot about like making each breath count because their theory is you only have a certain amount of breaths in your life.
What is your problem? You started with the telomeres, right? Yes. When the telomeres are done, you're dead.
You're dead.
Then you moved on to the stem cells. So you only have a certain amount of stem cells. You're dead.
You're going to die.
And now we're talking about the breaths.
Hold your breath.
What's next?
Well, no, just about like putting that like quality in everything you do in your life. So if you're starving and losing muscle all the time, like, is that really quality? If you go all in on just block and mTOR because excess energy uses up excess, it'd be like thinking that's my point with this, is that thinking in Eastern medicine, like, okay, so what if you exercise, you're taking a lot of breaths, you're shortening your life. Now, is that true? No. So I thought that was so funny because I remembered that mostly.
Oh, I remember that. You were like the angel of death coming in.
That's what you said.
Your stem cells are limited. You're dead. Mm-hmm. Your breasts are over. Oh, yeah, that was the best one. This is like an Asian thing, apparently.
Yes.
That you're born with a certain number of breaths, and once those happen, it's just you're dead.
Yeah, you're out of breaths.
Yeah.
Hold your breath.
Yeah.
Yes.
And the telomeres, which I'll hit on that a little bit, is concerning. And I actually thought about that conversation when I was looking up my stuff.
So it was perfect. So
Yeah.
your studies first. Take it away, Dr. Martin.
All right. So Amy and I both picked out a study. There's a lot of studies. And if you're asking me right now, like, why is this plastic surgery podcast talking about longevity? Are you kidding me?
And we're kind of in the world of anti-aging
We're
surgery.
surgeons. We're a surgery office that deals with the effects of aging, basically. And if you don't think that post-pregnancy changes are related to aging in some manner, they are. There's certain things we don't, like congenital deformities of the nose, like for rhinoplasty. There's certain things, but mostly it's about age-related issues. And so we're age-related issue surgeons. Hyperbaric oxygen therapy. Amy, can you kind of give me just a lowdown on what that is, HBO?
Yes. So before we do that, in the show notes, you can find links to these two studies. Dr. Martin's study is entitled Hyperbaric Oxygen Therapy Increases Telomere Length and Decreases Immunosenescence in Isolated...
Senescence. Say that one more time.
Immunosenescence.
Senescence. Okay, good.
This is what was my last S's stuttering. It's this immunosenescence in isolated blood cells. Blood cells.
Yeah.
Oh my goodness.
Yeah. So,
linked in the description box.
Right. And it was out of Tel Aviv. It was a big study. It actually involved humans, and we'll go through that. But what is hyperbaric oxygen therapy?
So it's done in a tank or a tent, really. So it's just really increased oxygen. So it's a very high percentage of oxygen.
So normally in the atmosphere when you're walking around, are we breathing 100% oxygen, Amy?
No.
Right? So oxygen is, per memory, is not the biggest percentage. It's actually nitrogen and some other things. So we're not breathing 100% oxygen.
It actually can damage brain cells. I mean, if they give you pure oxygen, you can have brain damage from that. It can kill brain cells.
So, and then as you go higher up in altitude, this is why people train for the Olympics up in Leadville in Colorado.
Actually, that balances out at 8,000 feet.
Okay. Why do you always have to take my thunder away?
Well, I grew up at 10,000 feet, so I know this.
Right.
That's why they train in Colorado Springs.
Around 8,000 feet.
That's
Leadville's at
where you maximize
10,200 feet, but around 8,000 feet. So they train up at higher altitudes because it's less oxygen in the air. They get anoxic quicker, and then their muscles get used to that, and they get more hemoglobin in their body. It's a natural way to blood dope, basically.
You know that they say that people who were born at altitude, meaning like a high altitude like I was, and
like
live there.
Yeah. Or weird.
We actually
Right,
have a
that's what they say.
30% greater ability of our lungs to absorb oxygen. Up to 30%. So I have 30% greater lung capacity than a sea level person.
Which is the exact reason that Sherpas exist.
That's right.
I mean,
You call me a
genetically,
Sherpa?
yeah, you are pretty much. You're a Sherpa from Breckenridge, Colorado.
Yeah.
And that's what hyperbaric oxygen is with pressure. And I think it's pure oxygen or like a high concentration of oxygen. They sit you in the tank for a certain period of time and you get this hyper-oxygenated environment.
Yeah, so it really infuses your cells with oxygen.
So, and I'm going to make this quick, but it's so interesting to go through the history of hyperbaric oxygen.
Well, I mean, that's actually great. I don't know how it started. I mean, I know they use it for scuba divers.
It started like centuries ago.
Was it for scuba?
Well, it started like in the 1800s going into the 1900s. And I watched a documentary on the Brooklyn Bridge, okay, which is a famous bridge.
Oh, yeah, that's the coolest thing to learn about.
And you know those pillars that bridges are based on? Those are called caissons, I guess. Mm-hmm. Is that a word that you know?
Well, caisson is what they use to they drill it and then they put the caisson in.
They put a caisson. The caisson is what it's all supported by.
Yeah.
When they did that, they would like build this barrier around it and put these people way down underneath, basically underneath water, okay? And they would have like scuba diving. They would have the same effects if you were down 30 feet or 40 feet down scuba diving. They would be down there all day and they got the bins.
Well, because you're still, I mean, you're still under that same amount of pressure when you're that low into the earth.
Right.
Even if it's not in water, you're still that far down.
Right. So they finally figured out, because the death rate of these workers working on these bridges was immense. Hundreds and hundreds of people were dying. And they finally figured out with hyperbaric oxygen therapy, and they would actually do it on site, so putting people under pressure, that they could mimic a slow elevation in the water. And that's why if you ever scuba dive, which I haven't, but you're going deep, you do a slow ascent.
To pressurize.
And that's what they do in these hyperbaric oxygen chambers. They change the pressure to like a more, not as heavy, or not as high of a pressure. So like you're going more toward the surface of the water, our normal pressure that we're that we experience.
So the hyperbaric, though, I mean, it diffuses the excess oxygen that would be in your blood vessels, right? That's what causes the bends when you come up, is you get too much, you get like an air bubble essentially, and the hyperbaric diffuses it.
And then you can have severe problems, neurologic problems, and death.
Yeah, you can get a PE essentially, right?
Yeah, I'm not an expert on the bends, but basically it's related to the nitrogen concentration, the air bubbles forming. That's what it is. So, and I'm sure there's going to be somebody watching this who actually is a scuba diver who was like, these people.
They're like, that's not it at all.
They just totally screwed it up. I'm a board certified plastic surgeon. So, anyways, and then they went on from there. They started treating other things. There was a famous cardiac surgeon in like Norway or someplace that Nils is from. And they built these hyperbaric oxygen chambers and did tetralogy of follow surgery for children.
In the chamber?
In the chamber.
Oh, wow.
Yeah. So, because the problem was
pressure.
oxygenation,
Yeah.
and they were infusing like 100% O2. I can't imagine.
And giving these kids brain damage.
What did they do when they used the Bovie? I don't know.
Oh my gosh, don't even think about that.
Like fire risk. And then they started using it for carbon monoxide poisoning. And that's when things changed and you started seeing hyperbaric oxygen chambers in major hospital centers.
For wound healing.
And now it's universal. It's around. And then they started using it for wound healing, for different types of cancers, for lung injuries. And so it's fairly prominent in healthcare these days. But it's interesting because it's still on the outskirts. It's not like someone goes to medical school and they say, I want to be a hyperbaric oxygen doctor, right? But there are people that have interest in that and different subspecialties that actually use this device. The funny thing is, it's never really, at least historically, we've never really looked at its effect on the body and the cells. So when you age, there's two different types of aging. There's phenotypic aging, which is what I treat, okay?
Still on the outside.
Right. The way you look, okay? Your skin gets saggy, your hair gets gray.
You're fat where you don't want it.
Right. You get fat where you don't want it. Your vision goes bad and your hearing goes worse and
What?
all these, yeah, exactly. But there's also aging in your cells. And they call that, what's like the biological clock, or there's a name that these kind of longevity experts use. So what's happening inside your cells, specifically what's happening with your DNA, and specifically DNA getting methylated in something called telomeres. So that's what my study was about. They looked at a few key components in the cell, specifically with DNA, to see what the effects of hyperbaric oxygen treatment was on actual adults.
Which
right?
I thought, I'm
Actual
so
people.
jealous because my study is done on animals.
Yeah, I only get human studies.
Like to find a study, but that's so rare. I mean, it's rare in anything because typically, it's not always ethical to do.
Which is one of the
studies on
reasons
people.
why they did this in Tel Aviv and not in America, probably.
Oh no, this is a completely ethical study because there's no it's not like you're giving one person a life-saving drug and not giving it to somebody else, which is done. I mean, in this, they were really just looking, we know that there's no downside of hyperbaric oxygen therapy, like that it has been well researched. I mean, it's actually used to help save people's lives from things like the bends and carbon monoxide poisoning. It helps with tissue healing. It is well understood that this is safe. So to me, I think, doing this in adults only makes sense. I mean, the only downside that any of these people had was that they had regular blood draws.
Right. They had before, during, and after. 35 adults, 64 years and older. So it wasn't young people.
But they had to be independent living.
Independent living and somewhat healthy.
Yeah,
so
they couldn't have like dementia or...
They didn't really have a lot of problems. So these were relatively healthy people. They did daily treatments, 60. And this is another thing. Like they did 60 treatments, 60. So I guess you have to postpone any trips you're supposed to go on.
Right, you got to do your hyperbaric every day.
And they looked at the regenerative effects on aging and on the cells themselves, specifically on inflammatory markers, but more importantly, telomeres. So, Amy, this gets into the weeds, but let's talk about telomeres.
Oh, I love this topic.
Okay. So, I remember being in 6th grade science class and learning about chromosomes, and they always show it as an X, like this. All right? The ends of those chromosomes have something called telomeres. And if you're old enough to remember shoestrings that had the clips on the end, what are those called?
Whose shoes do not have caps on their shoelaces? Everybody's do.
I feel like these days there's some fancy Nike stuff.
No, they all have it. You don't have, neither do I, but Nils has shoelaces on and they have,
Okay.
it's a little plastic thing at the end of your shoelaces.
Yeah. And we've all been in that situation because, you had the shoes where you maybe take the shoestrings out and put them back in, take them out, where that cap comes off, and then it's a big pain in the ass.
It's all frayed.
The shoestring becomes unraveled, it becomes frayed. And that's what can happen to your chromosomes over time with age. That's literally what happens with age and methylation. And Amy can talk about that.
Because every time your DNA replicates, those telomeres get a little bit shorter. And that's one of the key markers of aging. And that's what I was talking about in our podcast about longevity, was that those telomeres, as they shorten, once they're gone, that's it, they're gone. So you're more likely, as that cell continues to replicate, it's not going to be replicating perfectly. There's going to be more errors. There's going to be issues. That cell is going to not be healthy. So if you when you run out of telomeres, your healthy aging is pretty much over.
Right. And as Amy said, there's this replication process of your DNA going on trillions of times in your lifetime. And, in the over and over and over. And each time, those telomeres get a little shorter and a little shorter. This is like super depressing. Can we describe this some different way?
No, because this is the truth. This is the reality of aging.
I would rather be ignorant.
Oh,
okay.
I went to the next cell, but that's actually perfect timing.
Yeah. So when those telomeres actually get too short or are gone, then your cells become senescent. And that's the word that Amy has a hard time saying.
Marked for death, senescent.
Yeah, marked for death.
I can say it just fine when it's not followed by other words and other words.
So basically, senescence, these senescent cells are these like kind of zombie cells that are left. They take some of your resources. They're sitting there not doing anything, clogging up stuff and making you old, feeble and inflamed. Okay. Senescent cells are a major problem of aging. We've talked many different times before on ways to deal with senescence, and specifically these cells. What are some of those, Amy?
How to deal with senescent cells?
Yeah.
I mean, your best defense is to make sure that your body is clearing things appropriately. So making sure that your detox pathways are clear, that your immune system is functioning optimally, that you're not overburdened with inflammation.
So that's not smoking, not drinking, sleeping, mindfulness, no stress, which is definitely Amy and I's life.
We're so not stressful.
So not stressed at all.
Yeah. Not at all.
What is all the other things we do? Lifestyle stuff, just living a good life and a healthy life.
Yeah. Keeping them from building up, I think, is really that key part.
Right.
That's a key sign of aging and that's what they were looking at, was the level of senescent cells in the body, because the more that are accumulating just means that your body is not breaking them down, which, like Dr. Martin said, is just adding more work for your body to do. And as you age, all that stuff slows down and they just start piling up.
We've talked about before the mTOR pathways. That's a great episode 50. You should really watch that if you like this kind of stuff. And I'm all into mTOR because it helps with building and putting muscle on, but that does not contribute to removal of senescent cells. Okay, so inhibiting the mTOR pathway gets into these pathways like these sirtuin pathways
and autophagy,
and that gets into autophagy that removes those zombie cells. Okay.
You got to give your body the time it needs to clear everything out.
The way that you can do that, nutritionally speaking, which has been in the news lately and a lot of influencer kind of people do, is fasting or intermittent fasting. And that's what people do for weight loss. It's supposed to decrease the percentage of senescent cells you have, et cetera, right? But intermittent fasting is not always easy. Fasting itself can be difficult. It's good. Amy does it and she recommends it, but it's not always
to everybody, not across the board.
It doesn't always apply to everyone. And to be honest with you, it's difficult with certain lifestyles. It really is.
Well, and at certain points in life, you should absolutely not fast. You should absolutely not fast.
There's medications now that people are recommending, metformin, these kind of activate these kind of sirtuin-like pathways where you get removal of senescent cells. But metformin has side effects. So there's, we're not there yet. They're going to come out with treatments and medications. Aging is technically, even though they don't say this in medical school, it's a disease. It's a medical process that happens.
The thing that kills all of us.
Yeah. So they're going to come out with treatments of this process of problems with not having telomeres, problems with increased senescent cells in your body.
But so far, they haven't found anything that actually increases telomere length. Even the medications like giving telomerase, which is, the precursor of, essentially, you think you're you give somebody a bunch of telomerase, their telomeres are going to stop shortening.
Telomerase adds on back on. That's what's in your body. Eukaryotes have that.
And I think this is what I was talking about in that clip. The conundrum of aging is that there's not one thing that is the cause of aging. There's many things. And this is a great example that it's, telomeres, but they're also looking at senescent cells because it's not just one or the other.
Right.
It's all contributing.
Right. And so how great would it be if you had a treatment where, by the way, when you read the history of hyperbaric oxygen back in the 1900s, people used to go sit in these big spheres and hang out, have drinks, in these nice chairs and just chill out in a kind of higher atmosphere, sphere with oxygen.
Yeah, it's way easier than a lot of the other
It's not
treatments.
hard. You're hanging out, watching movies and listening to music. Yeah. Imagine you just do that and all of a sudden you reverse aging, at least on a cellular level.
Or even slow it.
So that's what my study showed.
So I love this.
Yeah.
What did they find? HBTO for the win?
Yeah. Hyperbaric oxygen therapy for the win.
Question mark?
Did it work? It actually did. What you found with this study is that it definitely increased the telomere length on, I think they were studying fibroblasts, whatever cell type they were studying, by 30%. It definitely decreased inflammatory markers, which I'm sure is associated with senescent cells, notably. And it was statistically significant.
You know what I thought? Oh, I'm sorry,
Go ahead,
I'm interrupt. Well, no, just I thought it was interesting because at 30 days they saw a big improvement, but at 60 days there was no significant statistical jump from there.
Yeah.
So you kind of do find that place where you level out.
Right.
Yep.
Now, does this make any difference to the future? They have no idea. Is this only a transient thing, so then it drops down? It could be.
Yeah, I wonder how long.
Right.
How long after the study they continued to monitor their blood levels.
Right.
That I'd be interested to see.
Yeah. I mean, there's a lot more studies to come. I wouldn't advise people to go out and do hyperbaric oxygen, but it just shows you that we're on this precipice of something new. That something's going to come out, that we're really going to start to treat aging from a cellular level. Mm-hmm. And that's really what aging is.
That's where it's happening.
Right? When you say phenotype in medicine, that just means the way that the stuff inside your cell expresses itself anatomy-wise, right? When you see genetics and DNA, that's like so nebulous for people, but they understand that, some people have wider shoulders, some people have narrow shoulders, and some people have different.
Epigenetics comes in.
Exactly. And then you get into epigenetics and methylation, and it gets very, very complicated. But I thought this study was very interesting. This is the first study that we've seen in humans that increases telomere length, which, by the way, is not always great because of cancer.
Right. There's downsides.
Yeah.
That's with everything in the body.
Some cancers don't do well with increased telomere length, right? And that's why you don't want to give telomerase to people that have occult cancers. You didn't know
make
it.
tumors grow.
So, because when those telomeres get short, they start the signaling cascade to this cell should be removed or it's a problem. So,
right. I mean, the last thing you want is to give telomerase to somebody who has a tumor that is activated by it, and that tumor can all of a sudden replicate, and your body doesn't get the signal to kill it.
Yeah. Because cancer cells are dysfunctional and they tend to have shortening of the telomeres when they replicate, because they replicate all the time. And
really rapidly.
That's the definition of cancer. So yeah, it's a pretty amazing study in humans.
I loved that. I was so jealous of your study.
Well, your studies are always better.
For that reason. Yeah.
So go hyperbaric oxygen therapy.
For the win. One interesting thing I will say, we do recommend hyperbaric therapy to our patients because the great thing about it is you can have it the day after surgery. It's not like cryotherapy where you can't be leaking, you can't have sutures in, there's things you can't start right away, even like infrared sauna, like you can't do that right after a tummy tuck, but you could absolutely leave the surgery center, drive to a place that has hyperbaric oxygen, walk right in with your drains in place and do it, because like Dr. Barnes said, you just sit there. It's normal temperature, you're not hot, you're not sweating. There's no contraindication and again, check with your own doctor. We're not your doctor. There's no contraindication for most patients, even to have hyperbaric therapy the day of surgery or the day after. The place we send our patients is actually a gym. So it's called Icelandic Fitness. If you're in Colorado, if you're in Denver, Icelandic Fitness, they have hyperbaric, and it's personal training. It's a gym. So it's you may not find it in a doctor's office even. So you got to look outside it's still one of those things like Dr. Barnes says.
Which is so weird.
You would think.
Thinking about the history of this treatment, it's been around since the 1600s
it's
actually.
Extremely well vetted.
And it doesn't have a lot of downsides. So why hasn't it been more incorporated in normal therapies?
Right, into healing and recovery.
Right.
And it's not even all that expensive. I mean, you can get a hyperbaric oxygen set up for like $20,000.
I think some of the problem was in the 50s and 40s, same old Kellogg kind of thing, all these doctors, and they built these $1 million things, and this treatment was going to solve everybody's problems. The AMA came out and said, this is fraudulent. And I think that sticks into the, into kind of the philosophy.
Well, I mean, do no harm. It's, I think as long as you, make sure that you understand that we're not saying this is going to extend your life or going to change your healing or anything, but it's also not going to hurt
I'll take the telomeres are 35% longer.
Yeah. It's also not going to hurt you.
What you told me that I'm going to die when my telomeres go away. So.
Well, you're not going to age well once they go away. Watch out for the stem cells.
Is there anything I can do for my breasts? Can I get more breasts? Can you purchase breasts?
No. You can't. You cannot.
Can I put it on my Amex card?
No. And
get some points?
You can't. You can buy a facelift, but you cannot buy more breaths.
I'm going to find a way.
All right. So Dr. Martin, I loved your study. I thought it was awesome. I'm super jealous that you actually did a human study. We're going to take a quick break to hear a word from our sponsors. Let's get checked. They don't do telomerase levels. You cannot get your senescent cells checked from them.
We should talk to their company and see if they'll start drawing telomerase levels.
Yeah.
To evaluate senescent cells. This is a senescent together.
Senescent. I do know it. I can't.
Immunosenescence.
Yes, that one. That's the one. Let's get checked.
Well, what does that even mean?
Dr. Martin, I'm super excited to talk about our sponsor for this podcast. Let's get checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like, you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it, literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like, is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board-certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah, so as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right, well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
And we're back.
We're back.
Everybody get checked. All right, so it's time for my study. My study is not as cool as your study because my study is an animal study, which we have talked about. Every time we do a research podcast, we talk about the fact that we do talk about animal research. If that offends you, I apologize. You can stop listening now. If you want to find the link to my study, it's in the description box. And
You don't even want to know how they did animal studies on telomeres. They gave them like a genetic condition where they can't restore their telomere length. And so they had premature aging and then studied them that way. You watch them die. Yeah.
So the realities of, animal studies are what they are, but, we, in research, ethical researchers are going to treat animals ethically, even though they are research subjects. So selenium supplementation inhibits IGF-1 signaling and confers methionine restriction-like health span benefits to mice.
Of course. This is the study I've been looking for. Methionine restriction-like health span.
Methionine.
Yeah.
So, okay. If you were to read this on your, normal Google browser, it would say selenium supplementation cures obesity.
Awesome.
Right? That's what it would say.
Selenium supplementation makes you a better person.
So everyone would be like, awesome, I'm going to supplement with selenium and I'm not going to be fat. That's not it at all. And that's where I love talking about the nutritional component of research.
So basically, Amy's the only one that ever reads these things.
Me and the people who wrote them.
Yeah.
So methionine restriction is known to extend lifespan in some species, including mice and yeast. So this is not done in humans. Methionine restriction is basically, it's an amino acid. It's an essential amino acid. It's also key for muscle building. So when you put these mice on these methionine restricted diets, they do live longer, but they are weak. They don't put on muscle. So their body mass is very low, but they also don't become obese, even eating in a slight caloric surplus. So it prevents obesity in mice. It's thought to work, so this is the methionine restriction, is thought to work primarily by lowering IGF-1 and FGF21 and some other hunger hormone levels. Not to get into too far into the weeds here. So basically, you're lowering this essential you're reducing this essential amino acid completely, which then lowers some of your inflammatory markers. IGF-1 is an insulin or a growth factor precursor, essentially. If you lower that, you do see decreases in a lot of other things, but there is a downside of that because it also means you don't put on muscle. So if you have super low IGF-1 levels, okay, great, you have way lower inflammatory markers, but you also can't put on muscle mass. So
you have what you refer to as sarcopenia.
Sarcopenia, yeah. Selenium supplementation has shown the same effect in lowering lab levels of IGF-1, but without the negative side effects of methionine restriction, primarily stunted growth. So you can see why in a human, you wouldn't want to stunt the growth of somebody just to maybe not have them be obese and live a little bit longer because as we've talked about, nobody wants to be the scared skinny mouse.
I don't want to be the scared
I don't want to be
mouse.
a scared
What
skinny
about you,
mouse,
Nels?
right?
No.
I always think of that. I'm like, man, it's the double-edged sort of aging. If you're suppressing mTOR, if you're lowering your IGF-1, if you have no growth hormone, okay, so you might live a little bit longer.
You see, this is the way I look at this, literally. And you can tell me if I'm wrong because you're the expert with all this stuff. I'm going all in on mTOR and I'm just hoping something comes along.
When you say going all in, you mean getting as much of it as you can?
No, getting muscle on and building and lifting and being functional and stretching and having energy and putting calories in my body and growing, as opposed to super restricting. Don't get me wrong. I believe in periodic
fasting.
Yeah, fasting to reset some things, but just like diet breaks and stuff like that. But I do think that I'm hoping that something comes along.
Right. You don't want to be the scared skinny mouse.
Right. I don't want to be the old person that's frail and 95 and have no quality of life.
Right. And you have sarcopenia and you have no quality of life. And that's the difference between healthy lifespan and just lifespan, right? Who wants to be a weak old person? Nobody. In studies, people who have IGF-1, what does it do? Okay, so yeah, it's an inflammatory marker, but what increases it? Working out. Well, you know what else that does is it decreases your risk of falls. It increases cognitive function, increases muscle mass. So there's always, always another side of this. And that's where...
that's when you break it down, the number one killer in the United States is not IGF-1. It's heart attacks and then lung cancer. And if those people actually worked out, they would probably be alive.
Right. They'd have better cardiac health.
And that's
diet, all that other stuff.
Overstatement.
Yes.
A majority of those people, they actually worked out and lived a healthy lifestyle.
Or even if, people died of a heart attack at 55. your healthy lifespan was real short.
Right. Totally.
You know, I mean, I think that's really the difference here. So this is what they were looking at. So is there a way to supplement with selenium instead of having to methionine restrict these mice and get the same effect? So let's first talk about selenium, right? I love selenium. So as a nutritional therapist, when I think of selenium, I mean, I recommend selenium to a lot of my patients. I recommend it to people who are struggling with some thyroid issues. I recommend it to almost all the men I do consultations with, specifically men over the age of 50, because it's really key for
Why are you
prostate
giving
health.
me selenium? Well, I'm not over 50, but
Right. Well, and we'll talk about it. Selenium is a trace mineral. It plays a major role in the body's metabolism. So it plays a big function in how your metabolism works, mostly because it's a cofactor of thyroid hormone, works synergistically with iodine. You know how I love talking about cofactors.
we love that.
It's a powerful antioxidant. So it's killing those radical oxygen species. Radical. What did I just say? Radical?
Radical.
Is radical even a word?
And I'm thinking it's methionine, but that's okay. But I like the way you say it better. That's okay.
Methionine?
Yeah. I don't know.
Yeah.
You say it.
Methionine.
Okay.
Methionine.
Yeah. There you go.
Yes. It's a powerful antioxidant. It reduces the risk of certain cancers and heart disease. It also decreases the negative side effects of radiation. So supplementing with selenium actually helps people who are struggling with like nausea and vomiting after radiation do better. It may slow age-related mental decline.
Wow.
Helps convert thyroid hormone into the active form, which we talked about. And that's specifically like when I'm talking to patients about their thyroid levels, when you see someone who's not converting thyroid hormone well, what you end up having in the body is a lot of inactive form of hormone, which then downregulates your body's production of hormone, which because it thinks it has enough, even though it's not active, selenium can help clear out all the inactive form
And you
of
can find out about
thyroid.
your thyroid levels with Let's Get Checked.
You can. You can do a full thyroid panel with Let's Get Checked.
We did that.
Also boosts your immune system. It's stored in the muscle tissue. So that's kind of cool, right? It just shows what an important role it plays in muscle and metabolism.
I mean, everyone should be on selenium from this slide.
But should they? So dose always matters. Symptoms of toxicity include bad breath and garlicky body odor,
That's
hair
not
loss,
good. Oh, that's not good.
dizziness, nausea, vomiting, facial flushing, tremors, muscle soreness. Muscle soreness makes sense, right? Because it's stored in the muscles. So if you have toxic levels of this in your muscles, it's going to inhibit the way they function in a really negative way.
Are people usually selenium deficient or not?
They aren't. And that's really the cool thing about selenium is that it is a micro nutrient. So it's something that you need. It's a trace element. So you need it in very small amounts, but it's very powerful in a very small dose. Things like this, it scares me when you see articles like this. And I think, oh my gosh, people are going to go out and start supplementing with selenium when they don't need to.
Right.
Normal people are getting selenium through their diet, specifically people who eat red meat because it's high in red meat. It's extremely high in Brazil nuts, which is what I have my patients usually supplement, quote unquote, supplement with.
I love Brazil nuts. I'm not joking.
Yeah.
I love them.
You can...
Nils? Yeah, I love them.
And they're so good for men. I mean, that's what I have my male patients do. I have them, and I say one a day because you can definitely go overboard. Depending on where something is grown and the soil quality is going to have a huge impact on how much selenium is in it. So there are some Brazil nuts that are tested that have like trace amounts of selenium and others have like 400 times your daily dose. The great thing about getting something from whole food, and I emphasize this all the time.
I've never heard this before.
I know you've never heard this, is that it's hard to overdo it on food. Brazil nuts are delicious, but are you really going to sit down and just eat like handfuls of them?
I find it hilarious that you said it's hard to overdo it on food, and just look at America.
Whole food. I said whole food.
Okay.
This is non-Frankenfood.
Okay.
I mean, how many Brazil nuts could you really eat in one
Yeah,
sitting?
you're right. No, you're absolutely right.
Yeah.
Like you've said
They're
that
not
before. Like
Doritos.
how much, right. You think of all whole foods, even fruit, like you can only eat so much
Right.
and then you're full.
Because there's fiber, there's fat, there's nutrients. Your body understands it's getting
Right.
food, so it's going to kind of stop you from overeating. Now, factory-produced foods of the Industrial Revolution, those are things you can absolutely overeat because your body, it's like, okay, well, like I just ate a whole box of cereal. I got my USDA of iron, but nothing else. Like I'm still starving.
Don't
because
forget
I
about
got
calcium. They add
real-
calcium too.
Yeah,
Calcium
great.
45.
That's in the milk that you're drinking.
Oh.
So my point with this really is that, you have to be careful when you look at studies like this because the option is not just great. Oh, great. I'll supplement with selenium and I'll never get fat. That is absolutely not true. There is a downside to this. This amazing trace mineral has a real downside, including smelling
number
like
one,
garlic.
Yeah. The hair loss would be the worst, but the garlic odor would not be good either.
The dizziness. Like, Dr. Martin, why are you so dizzy today?
I mean, garlic is very distinct. If you were standing next to someone and they smell like garlic, you would really
You know it.
Yeah.
So let's get back to the study. back in the lab, let's talk about the results. So does selenium supplementation prevent obesity? In mouse models, it does. Interestingly enough, and I love this fact, what do you think the same outcome is in rats?
What do you mean?
Do you think it works in rats?
Yeah.
Doesn't.
Why not?
They don't know. So you supplement with selenium in rats and you don't have that
Yeah,
same...
but isn't our DNA the 96% to a rodent?
This is my point about these things are not the same. You are not a mouse. You are not a lab mouse. You're also not a rat and you're also not yeast. This study was done on yeast and it was done, well, you have a lot of yeast, but you are not a yeast and you're not a mouse.
But they're all eukaryotes.
They are.
Yeah.
But that's my point, that things do not translate one-to-one from animal studies into humans.
Right.
They just don't. Even within other mammals, that are of the same type of mammal. You think rats and mice, basically the same, right? It's just a big mouse. Not true. Doesn't work the same for them. But in this specific study, they were really careful to make sure that they were not giving these mice an overdose of selenium, and that was what was causing them to not gain weight, right? Because we talked about,
You're nauseous, you're fatigued, your hair's falling out, you smell like garlic.
Yeah.
I don't want to eat.
Your muscles can't contract because they're so
Right.
jammed with selenium. You're vomiting all the time. Yes, if you induced selenium toxicity in a mouse, would it not be obese? Yeah, wouldn't be, but it would also not be healthy. So they were very careful to monitor not only the liver lab levels, so they were doing AST, ALT levels the entire time. They also calorie balanced the diets to make sure that they weren't making the diet unpalatable to the mice, and that's why it worked. So they took a whole group of methionine restricted mice and a whole group of supplemented mice. Calories were balanced. All lab levels were the same. So you weren't just inducing a selenium toxicity to give them the same result. And that's what they found. It had the same lowering of the IGF-1. It didn't have the same changes in growth hormone, though, which I thought was really cool. Just shows you what a whole food will do for you. In a good way, your body knows what to do with it. Something that was also interesting was that they put this in the mouse pellet. So they put it in the food. So they weren't giving them a supplement in addition to their food. They were just adding selenium to the diet. So something like maybe adding Brazil nuts versus taking a supplement. A French researcher had done a study previously where she gave mice straight up selenium supplementation in addition to their diet and found it to be highly toxic because it was really hard to monitor their levels, and all these mice were just becoming selenium toxicity and having all these problems. But they didn't find that with these mice because they were giving it as a whole food supplement, essentially. It was given in a different form and it had a different outcome. And I just, again, sorry, I am so far talking about stuff that's maybe really too geeky for people. But the takeaways...
That's what we do here. Don't hate.
I love it.
Yeah, I love it. I mean, whatever. Don't listen. I was I'm not totally into this.
The really cool thing, too, is that they did separate studies with male and female mice. The one downside of this, and they talk a lot about, I loved this research because they talked a lot about the not errors, but some of the the flaws in the research that made it, imperfect, essentially. The male mice that they had were very young. They were 2 months old. The female mice that they got were on average 8 to 9 months old, so much farther along in their growth cycle. But they looked at things specifically about the weight of the liver. They did autopsies on these mice after their death, and they weighed their gonadal fat pads and then also umbilical fat pads to test what the actual weight of these fat pads was. And they weighed their livers to make sure that they weren't having liver damage or anything else. So they really did treat these animals with respect and studied a lot of things that could potentially have damaged the study. But they did see differences in the way the female mice reacted versus the male mice. It was still protective of obesity in both groups, but in slightly different ways, which was interesting.
Okay. So should we take selenium? You got to tell us that.
So no, this does not mean it would have the same effect in humans. It just doesn't. We're way far away from that. And as we talked about, there are definitely downsides of supplementing with selenium, so I would not recommend doing that. It is a trace element. But my takeaway, as always, eat a nutrient-dense, properly prepared, whole food diet until more is known about the effects in humans.
Maybe Brazilian nuts.
Brazilian nuts?
Yeah.
Brazil nuts?
Yeah, Brazil nuts.
Yes. So...
It's not Brazilian?
It's not Brazilian. It's Brazil nuts.
Okay.
Brazilian nuts. That's something different. See?
I just got that. That took me a second.
D's nuts.
Yeah, okay.
We digress.
Brazil nuts. Okay,
Yeah.
gotcha.
Do you have any questions for me about the study?
No, I think that's so interesting. I think that's what I love about what you find is you're always looking at where this stuff is going. And clearly this is years away. but you're looking at things where you can fortify things that have aging in a way that has quality to it, but also can keep you healthy and, from a genetic standpoint, from a biologic standpoint, to be, better.
Yeah.
Yeah.
Oh, something else I super appreciate about this study. So I talked about how, thyroid hormone is really helped by selenium supplementation and iodine, blah, blah, blah. So maybe you'd think, okay, well, so these mice just had super high T3 because of all this selenium. Not true.
Not true.
They actually tested them all the way along to make sure that they were not artificially elevating their levels of thyroid hormone, because hypothyroid, you tend to have a very low body weight. That's actually one of the signs.
Hyperthyroid.
No, I said hypo. Hyperthyroid. Hyper,
High
you get too
thyroid,
much.
yeah.
If you have hyperthyroid.
Which is like these longevity people give thyroid hormone. And a lot of people do that for a weight loss method, which is probably problematic.
Yeah, it is. I mean, if your thyroid hormone is too high, you feel terrible. You have heart race that, your heart's racing.
You have anxiety.
You lose weight.
symptoms.
You lose your hair. Some of the same symptoms.
Brittle nails.
Yeah.
I remember that. Yeah.
Those are things that you don't want. So like I said, I really did appreciate that they made sure that these mice were not unhealthy compared to the control group and compared to the methionine restricted mice, that they all had the same lab levels. These mice were not suffering because of this diet from a health standpoint, and just really looked at the outcome, which was very fascinating.
So if you're looking on our YouTube channel, Sarah picked this slide, which is a great slide, but I really think it's a slide. If you actually look really close, it looks like they're looking at the stock market, which I think is hilarious.
Yeah, I think they
Because
are.
they got a number there,
Yep.
right? And they're looking
Looks
over
like
here as the pie chart.
Like a NASDAQ thing.
Yeah.
Well, I mean, data's data.
This woman's making some serious coin here. She's like trading Bitcoin. Yeah.
Yeah. So again, if you are at all interested in changes to your diet or supplementing, I would definitely recommend reaching out to a dietitian or a nutritional therapist to make sure.
Do we have a nutritional therapy counselor?
My name is Amy. I'm a nutritional therapy practitioner.
Exactly. That's what Amy does in real life. So if you wonder why she always picks like supplemental things, which are probably the things that would make most of an effect on our lives, that's what she does. And she knows all this stuff, and it's amazing. She's extremely intelligent, especially with this stuff. So.
Yeah, supplementing in isolation, though, is not the answer. So please don't read this study that you saw on your Google feed that said supplementing with selenium will prevent obesity. That's not true. At least
pretty much everything
yet.
you read on your Google feed is wrong.
Which, if you want to hear a good example
Amy
of
has
that,
proved this. Yeah.
Yes, go back to our Research We're Into 3.0 episode.
Oh, the poop one?
The poop episode. Yeah. Yes. Yeah, we're getting.
I still stand by what I originally thought.
What your Apple news feed told you about Paleolithic poop.
Right. That they weren't paleo, but really they didn't really know.
They didn't know.
Yeah. Okay.
All right. Well, thanks everyone so much for listening. I know this was not talking about plastic surgery. It was talking about aging, which is, as we talked about, definitely part of plastic surgery.
We know this is niche, but this is what Amy and I like. And we want to invite more people to learn about longevity, because we are the longevity surgeons. We are the longevity, wait, that doesn't make any sense. Longevity practice. We treat aging all the time. So why would someone who treats aging, the phenotypic effects of aging all the time, why wouldn't we care about what's going on in the inside? That would be arrogant on our part. It would be wonderful that we could help people age better, both physically and also on cellular level. So that's why we're interested in this. Hopefully you guys are too. What else we got to say about it?
So if you did come to this podcast because you just wanted to hear about a tummy tuck and you happened upon this episode, please subscribe. See, we have great stuff.
If you made it this far,
yes.
Listen,
subscribe.
When we get to 1,000 subscribers, you're definitely getting something.
So you'll see on the bottom of the screen right here.
Right here.
Nils has put the phone number where you can call and leave me a voicemail or send me a text message.
I think we need to push our hands lower to see how far Nils can put it down.
We do answer questions from viewers.
Can you put it right between this little area?
Can you put it right over here?
I want it to go around Amy's head.
Poor Nils.
Is that possible?
Maybe.
I think it is.
We're going to see.
3D animation.
So if you'd like to leave us a comment, a like, a rating, review, we really do appreciate it, and share us with your friends. It really helps us out a lot. And we do answer questions from listeners. So if you leave us a voicemail or send me a text, you might be featured on an episode of our podcast.
Some of our favorite episodes are your voicemails. So leave some voicemails.
Yeah. You can find us on YouTube at Jason Martin MD, and on Instagram at Beauty and the Surgeon Podcast. And we appreciate everyone for listening. Thank you so much.
Thank you so much.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.